or like I don't know, some kind
Yeah,
of thing, or
yeah,
like
absolutely.
a pillow or something like stuff like that.
Yeah, so I think one thing that's really helpful is from a partner perspective, like making sure those lights are always dimmed. Because
Mm-hmm.
what happens sometimes is, especially if you're birthing in a hospital, the team will walk in to check something or take your blood pressure or whatever it be. They flick all the lights on and someone forgets to turn them off. And for a birthing person, like they may not remember or they may not even ask for that. And so that's just a really simple way to allow the birthing person to kind of be in this safer environment where she can kind of go inward. um, and then like I always like the little fairy lights that can be really nice and just like
Mm-hmm.
tranquil in the room. um, you know Bringing some affirmation cards can be really helpful for the environment. It's not only related to sound, so hearing the affirmations, like the partner, the support team can read those things, but they can also look at them. Another thing that's really nice is essential oils. Those things can be really, really wonderful in labor, and you can bring a variety because sometimes you want that like soothing relaxation like lavender oil, but
Mm-hmm.
sometimes you want like something like orange because you need like a little pick me up. So
Mm-hmm.
having like a nice kit of essential oils
That's a really good tip.
can be really great. And then another one is like simple things like brushing your teeth. I know that sounds really bizarre, but like just like how your mouth tastes can really affect your mindset. And so having like a refreshed mouth can give you, same
Mm-hmm.
thing with like the orange. It's just like a little pick me up.
Yeah.
I also always carry honey sticks. So that can be a little boost if someone is starting to feel depleted. So like all those little things can really add up and make somebody
Mm-hmm.
feel just a little more comfortable.
Okay. Now, do you recommend in early labor to eat before, like going to the hospital and everything too?
Oh yeah. So early labor is all about that like nourishment, the rest. So
Mm-hmm.
eating, drink as much as you can, because what happens sometimes is we have false labor contractions or not as productive contractions if we're feeling if we're dehydrated. So making sure that you're hydrated, eating, emptying your bladder, as I mentioned, and rest. Those are like the big parts for early labor,
Right.
and things that people don't do enough. Like it sounds so simple,
Mm-hmm.
but it's something
Yeah,
you
no,
really
it's
have
true.
to
It
remember to
sounds
do.
simple, but when it's actually happening, it's like, okay, what do I have to do? I don't know. I just have to grab my bag and to go to the
Right.
hospital, you know? Yeah.
Or you just think it's like it's so simple that like how could this be that helpful? But it
Mm-hmm.
really is.
Yeah.
And that's the thing about birth, right? Like I always try to tell my clients, I'm like, it's not this like there's not like this secret tool to it, right? It's literally just letting the process unfold the way that it's meant
Mm-hmm.
to is our biggest tool for labor. And so much of that is having the person be comfortable, and breathing, so that breath work is another huge component to this. And um, even breath doesn't have to be complicated, right? So just those like slow, low abdominal breaths are such a huge key to labor. It doesn't have to be this like, Lamaze breathing or these like
Mm-hmm.
tools and techniques that are so complicated, because sometimes when we do that and we learn those things or we try to learn those things, we almost like question what our natural breath is telling us to do, because we're like, oh, maybe I should be doing something else.
Right. Yeah. Your motherly instincts start as soon as that labor starts.
Exactly,
Mm-hmm.
exactly. It's like you're born knowing how to give birth.
Mm-hmm.
It's really incredible. It's really just having the wherewithal to like let the process actually unfold the way it should. And unfortunately, we have to kind of recreate some of that because of the places that we give birth, which
Mm-hmm.
is for most people in a hospital,
Yeah. Okay. But we
you
can
know?
definitely make that environment a little bit more calming, as you had said before. So those
Exactly.
are good tips. Yeah.
And having a doula will be a great way to do that too, because, that person is there. That's like their number one job, right? To like
Right.
make sure mom, birthing person is comfortable and that the environment is one that she can just zone out and get into her work, and
Yeah.
really let things unfold.
Yeah.
It's a beautiful thing.
It is. Definitely. Okay. Do we have any other questions from anybody? Nothing coming in right now. Do
The
you have
one
anything
thing-
else that you want to say?
Yeah, the one thing I wanted to mention was I know we talked a little bit about like informed consent, right? And so giving yourself the opportunity, no matter where you are in your pregnancy or in labor, to kind of sit back and make an informed choice. And there's a really great way to do that. And it's a really easy acronym to remember. It's called BRAIN. And it really is like it's 5 things to do every time that something is presented to you as an option to make sure that you walk away feeling like you made an informed choice. So it's BRAIN. So it's benefits, risks, alternatives, intuition, and nothing, right? So right. So it's, what are the benefits to what you're suggesting or proposing? What are the risks associated with what you're proposing? Are there any alternatives? What is my intuition telling me? And what if we do nothing? Like, what if we just wait a day, an hour, a week? And this is something that you can start practicing now. And I don't think that it's something that can be used just for pregnancy or birth. It's something we can use for any sort of medical care, just so that we feel like we're involved in the decision-making process. And I find it's really helpful for like when I take my kids to the pediatrician too, so that I feel like, oh, I had a say in that choice for my child.
Yeah, I can definitely see how that helps.
Now, say if you're past your due date, now I know a lot of people nowadays are getting induced. But would you consider that, like, would they go through the stages of those 3 stages?
Absolutely. So you mean for an induction, would they go through?
Yeah.
Yeah, absolutely. So, an induction is really mimicking exactly what our body wants to do in natural labor. It's just that the tricky part is you're doing all of that early laboring in the hospital. So it's a little bit harder to navigate, but it's definitely possible. And your care team will want to see things unfold just as slowly as it would in regular labor, right? Because that means that it's safer for you and your body. They don't want to hit you hard with anything, which is why we want to do the softening of the cervix first, which is a lot of times done with what we call Cervidil or Cytotec. That's like the pharmaceutical drug that's used to soften up the cervix. And then there's some alternatives to that too. Like I've seen like the midwives, they use a Foley balloon where it's actually something that goes inside of your cervix and almost like manually dilates your cervix.
Oh, wow.
So that's something that's possible, but it's not like a drug that you're taking. So some people like that option. And then Pitocin, right? So Pitocin is the thing you hear probably all the time.
Yeah.
And essentially it's a synthetic form of oxytocin, and oxytocin is the hormone that causes contractions. So it's really just looking to mimic what your body would do in labor. So we're looking for the labor to mimic that too.
Okay. Good to know. Okay, thank you. That's really awesome advice.
Yeah, and if anybody wants to take, we have a few options for like the childbirth prep class that goes into more detail on all of what we've discussed, with just more like tangible tools and coping skills and things. We teach those here once a month. We also have a hypnobirthing class. The next one starts on April 28th. So registration is open for that. And we also do like a 6-part series, which I know you guys came to, and to give people more information on different topics. So outside of just childbirth ed, but CPR and newborn care and infant feeding, breast and bottle feeding, and all different topics. So we have a ton of those offerings.
Yeah, you guys have a great facility over there.
Yeah.
A whole benefit, all those benefits for moms and just overall wellness care. So we really love what you do over there.
Especially the 4th trimester classes. Those
Yeah.
are really helpful.
Yeah, we have one right now in the back started.
Oh, cool. And then you have those virtually as well. That's the one that I did. Yeah.
Yep,
It was
exactly.
really great.
Yeah. Well, I'm so glad you were part of that.
Yeah, it was really fun. And then some of the moms, we have like a texting thread. We still keep in touch and stuff. It's really nice. Yeah.
I love that. Yeah, a lot of the groups still keep in touch and like go on walks, or now they're meeting up here for baby and me yoga and things like that. So it's really good to build that like foundational community even beforehand, and we see that
Definitely.
a lot of the
Yeah, and especially last year when I did the postpartum class, it was like really still like COVID, like lockdown, and it's great that you had that virtual option. And now that people are getting out more, So it's
Mhm.
a good thing too. So that kind of built community, you know, virtually, and now, you know,
Right.
you can see people outside more and then in your facility as well. So that's really great.
Yeah, and we also have a prenatal support circle too. So that's a 6 week similar model. So it's 6 weeks, but it's for expectant people instead of postpartum. So it's real. That's
Oh,
good.
nice. Okay. Really good.
Yeah. Well, thank you so much for having me.
Oh, thank you so
Thank
much
you.
for coming
Yeah.
on here and doing the work that you do and talking and taking the time to talk about all of that pregnancy
course.
and labor and everything. Yeah. We really
Of course.
appreciate it. And we'll talk to you soon.
All right. Sounds good.
Okay. Bye, everybody.
Bye.
Thank you.